Okay, so I am 8 days post-op, and I'm actually recording from my car on purpose, so you can see what it looks like right after the stitches are getting removed. So most of the time they'll use topical over the stitches. It doesn't hurt that much. I don't have any dissolvables left, so they took everything out today. Your surgeon, I have read and experienced as few as four days and as long as 14 days. So it's very surgeon dependent in terms of when they feel comfortable taking the eyelid stitches out. The eyelids are among the fastest healing skin locations in the human body, so that does help us with this kind of surgery. I did ask about the bunching. I think I mentioned in yesterday's video, and I got the answer. I expected that it would flatten out. But you may notice a couple of things about my eyelids that are a little bit frustrating or unique, I guess we call it that. So this lid here is this brow area is very flat, and this one is normal contour. There was nothing removed from this on purpose. It should look full. This one here had a foreign body substance, I think I'd mentioned yesterday, and she told me today it was the size of a decent sized medium to large marble. What I saw in the jar was about half of that, so I was a little surprised to hear it was that large, but it took a lot of volume out of the lid, the brow area. So you can see one side is much fuller than the other. That will drive my OCD insane, plus it's going to make makeup a little challenging. So I asked her today if it doesn't settle down. First of all, does she expect it to settle down? And she said probably the swelling will come down a little bit on this side, but they're going to be uneven. So I asked her, do we take out from this side or do we add to this side? And she said basically if you're taking out, you can end up constantly, well, a little bit more because under, with anesthesia and so on, the lidocaine, it's really hard to see, right? It swells up the tissues. It's kind of hard to see how much you're taking out to make them exactly even. So she prefers, even though most likely what was stuck over here was filler, she actually prefers to lightly fill the location that's hollow if it ends up being hollow. And it bothers me. So most likely that will be something that I will end up doing forever, every 18 months, if this persists. It's possible that I will regrow fat in this area. She said she didn't really remove any fat, but the marble-sized foreign body was connected to tissue, muscle, and so on, right? So there's always some of that gets removed whenever you're completely resecting a piece of tissue. So that's one thing. The other thing, so that may not have a decent solution for now. The other thing you may have noticed is one of my eyelids, this one, is hanging down lower, right? It's ptosis or ptosis of the eyelid. It's hanging down lower than this one. I asked her to measure them, which she was going to do anyway. So when my lids are closed, they're actually the same size. So what's bringing it down is most likely, it's called secondary ptosis to edema. So that means it's not the primary cause of the problem, a primary problem. It's secondary to another problem. So in this case, it's secondary to swelling. So she thinks when the swelling resolves, this eyelid will go up to the right spot and it will match. I think the eyelid location of this one looks fantastic. I couldn't be happier with that. And it's still swollen, so it will continue to go up. But she said that they should be even when they are done. So when my eyes are closed and she measures, the distance of the eyelids are the same on both sides. And obviously they measure this stuff before they close, but crap still happens, right? So what can we do? You want to just get your nerves calmed a little bit. So I did ask her about, so as I had mentioned yesterday, I haven't done Botox or anything in a very long time. And preparing for this surgery, she said she wouldn't do it until she knows that the lids and the eyebrow and so on are evened. They're evened out where I want them to be. Otherwise, you don't know if is it Botox causing the problem? Is it surgery? Is it swelling? What exactly is it? So until everything's evened out, she doesn't want to add more variables. And that totally makes sense. I don't even know why I asked that, to be honest. I should know better. So anyway, that's where things are today. And there's just a little bit. I'll show you each eye, or I'll close them and then you can see each eye independently. There's just a little bit of residual redness. This bruise, as I mentioned, was from lidocaine for the CO2 laser. I did notice I have a little line under here, under both eyes, after the CO2 laser that I've never had before. So we'll see if that stays or goes away with time. And then that's pretty much it. So I will probably, I know I mentioned I'm kind of anti-ice. I will probably start icing in particular my right eye, this one that has the drooping eyelid, a couple times, 3 or 4 times a day, and see if I can get some of that swelling to dissipate. So I have an appointment next Thursday. That will be post-op day 14. And I will produce little videos between now and then and show you how things are going. So I hope this helps those of you in recovery or contemplating the surgery, and I'll see you all soon. Hi, welcome back to Channeling Beauty with Dani B. So this is my 11-day post-op blepharoplasty update. And obviously I'm still not wearing any makeup. I should probably change the channel to channeling bruises. The bruise is still prominent and taking his hold on my face. I am using vitamin K, so hopefully it's in clinical studies shown to minimize the effect of bruising a little bit, and some other studies say nothing at all, so it's worth a shot. Still have bad bruising, post hemosiderin staining from Quo. That's another video for another day. It's ridiculous, but I digress. Okay, let's take a look at this for those of you who are maybe facing some similar issues like asymmetry. So I had that blob of stuff in my right eyebrow, as I had said in my last video. And unfortunately, that has left me, I'm gonna pull my hair back a little bit here. It's left me with a flat spot here because they did have to take quite a bit out. Now it was supposed to just be the tissue or the foreign body, right? But it's almost impossible to not get the fat and other tissue around it. So it did leave it flatter. I'll see if I can come in a little bit. It did leave it flatter here. You can see how bad this is still than it did here. So this still has a round shape. In the old days, meaning like 10 years ago in the literature, you'll see that this side is actually how they used to do blepharoplasties, and it was kind of the preferred method or request by patients. And now they want some roundness, some fullness still usually in the eye, because that is a sign of youth, right? When you lose the fat pads, that is when you start to age. So this may still have to be addressed. Remains to be seen how flat this one ends up. As long as they're somewhat even, and when the sutures relax a bit and allow the skin to come down, they may look even enough that I stop OCDing about it a little bit. But the other issue, and the bigger one, honestly the bigger one to me, even though other people seem to notice the brow more, is that my eyes are not even, and they were even before surgery. So I have plenty of pre-op photos I took of myself and of issues where I was pointing out what the problems were with that I wanted to get addressed while they were taking out what we thought was a tear duct, or not taking it out, but putting it back, or a fat pad, and turned out to not be during surgery, as I explained in the, I think it was 8-day post-op, losing track now. So unfortunately, if you, maybe, I think you can see this. My lighting is not so good at the moment. I'm kind of doing an impromptu video here, but you can see that I'll just look straight into the camera. You can see that my eyelids, this one droops down more than this one. It's about 1 to 2 millimeters, but it's enough to make this eye look like I'm half asleep and this eye look like I'm awake, sort of. So if the outcome looked like this, you can't see my whole eyeball, right? And I have a photo from 10 years ago, and I had big bright eyes and I liked it a lot. I think that looked really good and youthful. That's probably not going to come back realistically. However, this eye to me is not acceptable, right? So it's too much, there's too much lid, there's too much droop. So my surgeon, as I had mentioned right after I left her office, she said that the eyelids are actually the same length. So hopefully this is still residual swelling. It does seem to be getting a little bit better. I take the little shots, right, of my eyes and screen them out and put them above each other like you see, and I'll post a few of them. But it's still too much for me. If you see here, you can see that where the eyelid is, where it falls, is not even with the other side. So there is a little bit of a nuance here, and I don't know how well you can see this in the camera, but right here, right above where it looks like there's excess lid, there's also what looks like almost a second crease. It's right above the incision line. My daughter and my boyfriend both said it looks like an indent. It looks like she put her finger there, pushed it, or she scraped out tissue or something. She didn't do that, right? So all they do is take skin in this area. She didn't dig in with anything. So it shouldn't be indented there. But I do think that there's some illusion happening with the redness of the scar and a little bit of bruising still left, that's making it look like this is indented, and it's exaggerating the length of the lid even more, which is the last thing that I need right now. So what do I do from here? Nothing. Unfortunately, every morning my eyes are so puffy, I can't tell. There's too much swelling. The reason I did this video now about, let's see what time it is, 7:45 in the evening, is because my eyes don't have that much of the puffy swelling at the moment. There's just sort of the residual swelling from the surgery. It's not because I was laying down and laying on them and all those things. So moving my hair out of the way, you can see that I'm trying to see. It's so weird. I can't see in my camera at the same time. Sorry, everyone. But you can see that one is just, this one here looks like, you know, looks like I slept, I think. I didn't sleep, but it looks like it. And this one here looks like I did not, right? So when the swelling is gone, I'm going to see her again on Thursday. That will be 14 days, 2 weeks past my surgery date. If it's still like that, here's my experience, and we'll see what she says, is that they ask you to come back at 2 months. And, you know, 1.5 to 2 months, 6 weeks to 8 weeks. If it's still like that, then we come up with some kind of treatment plan. The options for me at this point would be to shorten the length of take out more skin essentially on the lid and raise it up a little bit. There's a lot of things this can be, right? It can be a muscle being a little bit lazy, ptosis, right? Ptosis can be secondary to edema. It can also be secondary to other problems. I didn't have it before surgery. That I do know. So could there be nerve damage from surgery? That's unlikely. I would have other problems, and it's very rare. Could there be, a muscle that's a little bit weaker now? It's possible. Again, that's pretty rare. Could there have been an unevenness in the surgical procedure? Definitely. That's much less rare, even in the hands of a very skilled surgeon, because when you have the eyelid open and you've got injections of lidocaine and so on, everything's kind of distorted a bit. So they use a lot of measurements, pre-measurements that they're going to take a lot of before you go under the knife, and then of course they'll measure while you're actually having the procedure. So I'll keep you posted on how the process goes. Obviously, my eyes look a lot better than they did in my mind a few days ago. So I'm trying to be optimistic, but I do tend to hyper focus on these things people might think is no big deal. I asked someone today, what do you think of my uneven eyelid? And she squinted and she's like, never would have noticed if you didn't tell me. Well, if you undergo any sort of surgery to fix something, it's kind of not acceptable, right, to yourself. Many people will be fine with it, but for me, it's not. So I don't expect perfection, but I expect pretty darn close to it when it comes to procedures like this. So we'll see how it goes. Overall, I mean, I'm still really pleased with the way my surgeon's handling everything. Obviously, there's no issue as of yet. Do I think it's going to self-resolve? 50-50 chance. My own personal luck has been that it will not. If I'm trying to be optimistic, then I will say hopefully yes, but we'll see how it goes. So anyway, that's my update, and I'll post some photos, and just keep your fingers crossed, everyone. So I did see the surgeon, and she was looking at the incision line, which is looking really good. It's actually, I'll try to shut my eye. So that's 14 days. There's just a little bit of darkness here. This one, there's a little bit more. The skin is folded over. So there's some thickness to the scar right now, but that will even out. And the eyelids heal really well. Generally speaking, they heal really well. I had an extended incision because I did not want to have a forehead lift. So I have an extended incision that goes into the crow's feet. Honestly, I really can't, and I'm pretty particular, I really can't even notice it. So I think she did a really good job with that. The only residual issue for me, honestly, I would just not even go back again, because once I'm healed and good to go, I just move on. But she wants to see me in 2 months, which for me, I'll be traveling, so it'll be 2.5. So that'll be 3 months post-op. Is that if you look at my right, this one, you will see that the lid sits down further on my eye than the other side. So she had me just hold it from the lash line and pull it up, pull it up, pull it up. And then of course it looks normal for like a second, right? But then it falls back again. So that tells me, the fact that she had me doing that tells me that she probably thinks it's muscle related. and not sizing, because she did measure again today. She didn't say anything, but I think if there was a size difference, you know, I probably would have heard something. And maybe not. Sometimes they don't want to scare you early on, right? And honestly, sometimes with plastics, you do learn to live with your new features. And sometimes surgeons want to wait just to see if you are okay with it, or if you do want to fix something. So I'm not okay with this. If this doesn't get resolved, it will have to be fixed surgically. And you can see that this eyelid droops down more than the other. For me, it's something that is more than bothersome. I think I look half asleep. My eyes do still feel heavy, by the way, for those of you at 14 days post-op. If your eyes feel heavy and kind of tired all the time, it's pretty normal. Another week or two, they'll start to stretch out and the incision lays flatter, and then you start to see more of your results. She did say I still have some swelling, but I do not think that's causing the eyelid problem on my right, this guy. So she said to just keep pushing it up. Well, that tells me she might think that the muscle is kind of being a little bit lazy, and maybe I have ptosis. That can be repaired with a muscle repair. It can also be that they just remove a little bit more of the lid tissue if there's enough left to remove that allows you to still fully close your eyes. So one of the risks with blepharoplasty, it's really rare, but it happens, is that you close your eyes, but you can't close them all the way because there was too much skin taken. So obviously that would be a huge disaster, and they always want to avoid that. But I do think there was so much kind of trauma to this right eye because of the foreign object that they removed, or foreign bodies that they removed. There could have been some muscle damage, so that may be causing it, or it may be uneven, right? They may have just taken a little bit more skin from the left than they did from the right. So it's probably 1 millimeter, maybe 2 millimeters dropped. To me, it looks like it's 5. I mean, I'm laser focused on it. So that's where I'm at. So it's 14 days. I will take a look at it in the next week or so and post another video.